The Waldent Radiopaque Composite Fiber Post is a modern, durable solution for restoring root canal treated teeth. It combines superior aesthetics, dental-like elasticity, and minimal fracture risk, making it ideal for long-lasting and natural-looking restorations. Post dimensions: set of 5 fiber posts, white 1.2 millimeters, yellow 1.4 millimeters, red 1.6 millimeters, blue 1.8 millimeters in diameter. Drill dimensions: white 1.2 millimeters, yellow 1.4 millimeters, red 1.6 millimeters, and blue 1.8 millimeters. Fiber posts are indicated in the following scenarios: endodontically treated teeth, when there is significant loss of tooth structure and core buildup is required for crown placement. Teeth with thin root wall, as fiber posts exert less stress compared to metal posts. Anterior teeth restoration: due to their translucency, fiber posts are ideal for aesthetic zones. Fractured teeth: to restore fractured teeth with minimal tooth structure remaining. Procedure for inserting a fiber post: case selection and preparation. Perform thorough cleaning, shaping, and verification of proper obturation of the root canals. Assess the tooth clinically and radiographically to ensure there is sufficient root length for post placement. Post space preparation: remove gutta percha. Employ gauge Glidden drills or an endodontic heat carrier to remove gutta percha from the coronal and middle thirds of each root until the desired length is achieved. Shape the post space according to the size of the fiber post. Select an appropriate fiber post size based on the prepared canal. Try the post in the canal to ensure a snug fit without excessive force. Surface treatment of fiber post: clean the fiber post with alcohol to remove contaminants. Apply saline coupling agent to enhance bonding. Fiber post placement: apply an etchant over the entire canal wall for 10 to 15 seconds. Rinse thoroughly with water. Remove excess moisture using gentle air jets and absorbent paper points. Ensure the canal is completely dry. Apply bonding agent to the canal walls and light cure. Fill canal with flowable composite resin before inserting the post and insert it into the canal, ensuring it reaches full depth while allowing excess material to vent. Remove excess cement and cure with a curing light. Refine the preparation with a finishing burr. Thanks for watching. Please like, share, and comment for more informative videos.